if something that captures your interest is power, money, fame, or sex, these are the 4 drivers of human behavior, then that's not going to be a very satisfying life. I've always made the point that the center of the healthcare universe is the doctor-patient relationship. From that arises pharmaceutical industry, because the doctor writes a prescription. From that arises the labs and diagnostic, because the doctor says, I want you to do this lab test, I want you to do this MRI. From that arises the need for a hospital, because the doctor says, oh, you need to have an appendix surgery, you need to get admitted for a hospital.
So how do you think the doctor community or a healthcare professional and in general technology, they adapt to each other? What would be the best way forward in your view?
Looking forward, I think there is going to be a reversal of trend, or there is an opportunity to reverse this trend. The trend I'm referring to is concentration of healthcare into the hospital. So there is an opportunity to create solutions which allow healthcare to become health. How do you live healthier? Healthcare means first you fall sick, then come to us as a doctor or a hospital. Health means you are 30 years old, you are healthy. How do you want to be healthy till you're 70? I think it's a very exciting time to be a 30-year-old, 25-year-old, 40-year-old in this audience. All of you should look towards living to at least 100 and a healthy 100.
Hello everyone. Welcome to the next episode of Evolve. Talks about healthcare's digital evolution. I am Vikalp Sahni, your host, navigating this dynamic landscape of healthcare and technology. I am thrilled to introduce our distinguished guest, Dr. Ajay Bakshi. Dr. Bakshi is a multifaceted leader in the healthcare industry with an extremely impressive and diverse background. From being a former neurosurgeon, a neuroscientist, to a seasoned consultant with McKinsey & Company, to holding CEO positions at prestigious institutions such as Max Healthcare, Manipal Hospitals, and the India operations of IHH, Parkway Hospitals, and now the co-founder of NeuranceAI, a groundbreaking venture that merges neuroscience with artificial intelligence to develop innovative technology products. Dr. Bakshi's professional journey is nothing short of inspiring to people from any walk of life, be it technologist or a doctor. Join us in this episode where we explore and talk about fundamental changes in healthcare and how India has the potential to become global leader, both in public and private health. Thank you, Dr. Bakshi. It's a pleasure hosting you here today. I remember, I think it's a year and a half or 2 years ago, I saw that presentation you shared in an NHA meet. It was very inspiring for me also personally. And I still remember post that I was speaking to my team that my resolve for solving for health tech actually cemented further after listening to you. And from there to now hosting you here at our office is an immense pleasure for me.
Thank you for having me.
And I think your story is also quite inspiring. You are a great neurosurgeon, and from there, administrator, CEO of multiple big hospitals in the country, work with government as well. I think you're a very well-known figure in the doctor fraternity, and now a founder, entrepreneur. I mean, it's like, how is it possible to do all of that in one single life? So what inspires you? What drives you? Tell us something about your story. How did you do all of this?
Sure. No, thank you. It's a privilege to come here and meet your dynamic team. I would just say that, look, I always try to look forward, not back. That has always been the goal in my life, because what has gone is gone. You have learned something, you have built something in your mind and in your skills. But the exciting part of life is always ahead of you, right? So I have applied that from, becoming a neurosurgeon to becoming a scientist to becoming a business professional. The biggest secret of life, and I'm borrowing this from a lecture I gave at Ashoka called Living with Purpose, is that you have to discover what captures your interest. that is the hardest journey in one way, but it's also the most important, because if you think about it, you can't force yourself to be interested in something. It comes from somewhere very deep, from your subconscious, from your upbringing, from the society in which you are growing. What captures your interest? Is it music? Is it sports? Is it dancing? Is it reading about the brain, which was the case in my story, that I was fascinated by neuroscience. And I have been in my last 30 years. So to go from neurosurgery to artificial intelligence is actually not that diverse a journey. If I was born probably a century ago, artificial intelligence was not there. Maybe I would have been a neuroscientist. But the point is, what captures your interest, and then to pursue that is what leads you to an interesting life. And one thing is for sure, if something that captures your interest is power, money, fame, or sex, these are the 4 drivers of human behavior, then that's not going to be a very satisfying life. Because if you have X power, you want more power. If you have Y fame, you want more fame. That is an external manifestation of your journey, and to live from external manifestations is never very satisfying. But if you find the internal drive of what captures your interest and pursue that, that's what I have done. It's N of 1, but it's been an interesting journey, and I'm very excited to think about what the world is going to be in the next 5 years, 10 years.
Yeah.
I don't know if that answers your question.
No,
but
absolutely. And I can relate to a lot of this that you also mentioned in my journey as well, that sense of purpose and passion towards that purpose is so important. And I think that is how many of us have also started into this journey at Eka and solving for health tech. But this, I mean, it's easier said and done, as you were also mentioning. And all of this, in this journey, Dr. Bakshi, you were an administrator. You are a doctor. You have seen that side of a story as well. Now you are a founder of a health tech company. It's a conglomerate of technology, health, a lot of this. And you've been part of this for so many years. What do you see as the macro trends that are driving in the whole healthcare and then health tech around all that is happening today?
Sure. So let me rewind back to the 1960s, and I'll just take 2-3 minutes to summarize, last almost 70-80 years. 1960s, the general practitioner was the center of healthcare. People used to go to this doctor. He knew everybody in your family, and people trusted this guy. What started changing in the 70s and 80s is as science and technology advanced. CT scan came up in the early 70s, then by 80s, MRI technology came in, diagnostic technologies improved, surgical technologies improved, ICU technologies improved, which on one hand led to improvement of healthcare outcomes, but it also led to increased capex requirements.
Right.
An MRI machine cost a few $1 million. So how is a GP going to afford an MRI machine? Not possible. In parallel, in the healthcare side, knowledge expanded, partly driven by these diagnostic techniques and treatment techniques. When I was a surgery resident, my professor was a general surgeon. He could operate on a varicose vein, he could operate on the liver, and he could operate on the heart. Fast forward 20 years, nobody can, right? And pretty much nobody can, because you have to specialize. Just knowing enough about the liver, in fact, nowadays there are liver transplant surgeons who are different from hepatic surgeons. A liver cancer will be done by somebody else, and a liver transplant will be done by somebody. So that is a level of knowledge that is required to be mastered. So on one hand, specialization, on the other hand, increasing cost led to the emergence of hospitals. Not emergence, or more, what should I say, power going to the hospitals away from the doctors.
Yeah.
Then, and then you saw in India, if you talk about, you saw Dr. Pratapa Reddy setting up Apollo, Dr. Naresh Chand setting up Escorts, Dr. Devi Shetty setting up Narayana. So a bunch of these doctor entrepreneurs came and set up these hospital chains. But if you now come to 2010s, the real power lies with the ability to raise capital. Right? So therefore, now what you're seeing is more private equity coming into hospitals.
Yeah.
So why I'm saying all this is that the power of the doctor in influencing healthcare has shrunken over the last 50, 60 years. It has become more of a technical expert and not the driver of the ecosystem. Whereas the managers, the financiers, the investors have become more important. Now, in all of this, the patient still trusts the doctor.
Absolutely.
Right? The patient still trusts the doctor. Despite whatever criticism may happen, finally, if the doctor says, don't do this, no matter what the CEO of the hospital may say, no matter what the pharma company may say, no matter what the medtech device company may say, a family will trust the doctors. Right? So, I think what these macro trends of increasing specialization, increasingly expensive technology becoming available, which leads to better outcomes on the diagnostic side as well as on the treatment side, has done some improvements, but the trust factor between the doctor and the patient remains. And in fact, if you go back to that presentation that you are talking about, I've always made the point that the center of the healthcare universe is the doctor-patient relationship. From that arises pharmaceutical industry, because the doctor writes the prescription. From that arises the labs and diagnostic, because the doctor says, I want you to do this lab test, I want you to do this MRI. From that arises the need for a hospital, because the doctor says, oh, you need to have an appendix surgery, you need to get admitted for a hospital. So I think if we go back to this configuration of building tools which strengthen the doctor-patient relationship, and then we are more aligned with how citizens view healthcare.
Right.
Rather than, oh, doctor is insignificant. If you don't have one doctor, I'll shift to the other doctor. People have tried it. I don't think it works.
Yeah.
I don't think citizens find it. I'm calling them citizens, not patients, because not everybody is a patient, but people don't find it very fruitful. It's not like a restaurant that you don't like one food, you go to another one.
Yeah.
A doctor-patient relationship remains almost a lifelong thing. You are literally handing your life to the doctor. That, sir, please go fix my heart.
Right.
What more? Where else would you need more trust?
Yeah.
That I'm allowing you to cut me open and fix my heart or my brain or my kidney or whatever, right?
Yeah.
So that need for trust is not going to go away. So the technology companies have to learn how to build on that trust rather than how to minimize or make fun of that trust.
Right.
It's not going to go away.
Yeah. Yeah. No, it's so rightly said, Dr. Bakshi. I think, and we also keep debating on this internally, that fundamental of healthcare is the doctor-patient relationship and connect. And if I may talk about my previous experience in hotel industry or any e-commerce industry, we used to look at a number called repeat rates. Those repeat rates is of a healthy business is 20%, 30%. But if we look at repeats at a doctor clinic, these repeats are upwards of 70, 80%.
Yeah.
Which means that I as a patient would always want to go to the same doctor because there is where my information is and trust, and likewise. So it's a very sacrosanct relationship. It's a path that both of them want to take for a really long. But that also brings us to another, and you also mentioned about these large macro trends where there is power struggle or power shifting, technology coming in, and technology is evolving, right? Those were the days when there was just computers, and then there was internet, connectivity just zoomed in, then the data. AI, you only mentioned that all of these diagnostics and surgeries are helping better outcomes, and now robotics. So how do you think the doctor community or a healthcare professional and in general technology, they adapt to each other? What would be the best way forward in your view?
So looking forward, I think there is going to be a reversal of trend, or there is an opportunity to reverse this trend. The trend I'm referring to is concentration of healthcare into the hospital. That has happened over the last 50 years because of diagnostics and treatment modalities that we talked about. Now, with the coming of AI, it is now possible to have, so what does, look, AI is a very complicated term, so I'll just simplify it. What happened in the dot-com time was all knowledge became available to everybody. You could go to a website, look it up. You don't need to go to a library or have access to a special textbook. You can look it up on Wikipedia. At least the entry-level knowledge was available to everybody, right? So that's essentially what the internet bubble did. What mobile did was one more thing, made it available on your phone. So you don't even need a laptop or a desktop. You can get it on your phone. And plus, it also did one more powerful thing. It connected 8 billion people through one 10-digit number. I can dial somebody in Brazil. I can dial somebody in Costa Rica. Doesn't matter, right? Now, think of it this way. Intelligence is available on the tap.
Absolutely, yeah.
What does that mean? What means that information is just an input into an action. So, as a neuroscientist, and of course, I studied this deeply, intelligence is not just problem solving. Intelligence is perceiving, making a decision on that perception, and action. It combines all three. So you are understanding what is happening in the world, you are doing some processing of that information, and then you are deciding on an action. So now intelligence which leads you to an action is available on a tap. That's the theory. Okay, now let's come to the practical. What does that mean for healthcare? We are now living in a time when chronic diseases affect almost everybody. If you look at the statistics, more than the age of 60, at least one, maybe two, maybe four chronic diseases will be there. Hypertension, heart disease, diabetes, pre-obesity.
Every family.
You take any country, you take India, which is a middle level country, you take USA, you take developed markets, it's there. Now, what does the hospital-based or a clinic-based model have to offer to that? Is come to me once in 2 months, I will see you, I will write a prescription and you figure it out. So that's basically giving some information, knowledge, but not action. What does AI make it possible? That you can now ask an AI agent, I am doing this, is this right or wrong? And that AI agent can monitor your sleep, your food, your physical activity, and say, hey, you have not moved enough, you are a hypertensive, you are eating too much salt, you are a diabetic, okay, you have this burpee, but then you make sure you compensate in the evening, I'll help you compensate in the evening.
More like a coach.
So so there is an opportunity to create solutions which allow healthcare to become health. How do you live healthier? Healthcare means first you fall sick, then come to us as a doctor or a hospital. Health means you are 30 years old, you are healthy. How do you want to be healthy till you are 70? And not fall into hypertension, diabetes, lung cancer, whatever, by the time you're 45, right? So there is now that opportunity. So what I predict happening is you will still need hospitals. Hospitals become more complex, more sophisticated, and you will only go to the hospital to have a major procedure, a major correction in your anatomy or your physiology, whatever is wrong with your, depending upon the organ system. But after that, you will go home fast, and then you will rely on these intelligences, whichever form they take. They could be coaches, they could be monitoring systems, they could be robots, like you mentioned, especially if you're elderly. Japan is already struggling with elderly care and they are most advanced in robotics. So all of these intelligences and different embodiments will allow you to live a normal, healthier life for much longer than, our parents' generation has been able to. You are still a bit younger than me, so you will be a bigger beneficiary of this. But I am already 55, so I am hoping that by the time I start reaching this threshold of getting chronic diseases, we have these guys, these army of agents around us, in whichever form that they take, who can enable us, empower us toward taking actions which lead to healthier life, not just go read a blog and find a recipe and cook, right? I mean, that you need a huge amount of motivation to be able to do that.
Right. And I think you said it very right, like solve for health, which is basically a lot can be done on the preventive side, where this technology can marry with doctors' knowledge to keep the patients out of hospital. And all of us eventually want that in our life. Nobody...
Exactly. See, finally, death is inevitable, but the gifted life is that you live healthy for as long as you can, and then you suddenly drop dead.
Yeah.
Actually, that is the best way to go. You die in your sleep is a blessing.
Exactly.
And if that is enabled through this AI revolution and robotics revolution and a bunch of other things, converging forces that are happening, I think it's a very exciting time to be a 30-year-old, 25-year-old, 40-year-old in this audience. All of you should look towards living to at least 100, and a healthy 100, not a dependent 100.
Yeah.
Right?
Yeah.
So that's an interesting...
Maybe not dependent on robots, but on your legs.
I would argue robots could be fun. Actually, robots could be fun. I mean, if a robot can fly you to a different destination when you're 85-year-old, why not?
Yeah. No, good perspective. Good perspective. Dr. Bakshi, like this, and you touched upon that topic of chronics and scale and how large is the problem, and it's all stemming through a lot of lifestyle changes as well. And like a little segue from technology, because you have worked so much with government as well and at a population scale level, you also built the first mortality predictor for dialysis patients, and also your talks on mental health, and in many cases how that is connected to the kids and how malnutrition sort of is prevalent. Would love to understand your thoughts around how in this whole healthcare world the population scale changes can be driven, and what would be one or two most important population scale changes that you would want to talk about?
Yeah. So actually great timing of this question, because we are now sitting in India in 2024. 1.5 billion people are in India, but I don't think people realize that 23 million babies are born in India. Right?
Wow.
Do you know which is the next country? Can you take a guess? China.
China, yeah.
But what is the number?
It would be
Take a
close
guess. If India is 23, then how much would be China?
Closer to us or a little less maybe?
It's 9 million.
Wow.
China is 9 million births in a year. India is 23 million.
Wow.
After that is Indonesia, then Nigeria. So if you add the next 4, then that is equal to India. So you may argue that India is creating the next batch of humanity for whatever reason. So there is a sort of burden on us as a society. So why am I saying that is that there is this program that I work at iSpirit, and we are starting to build this program, and that is getting some traction with some senior government leaders, political leaders as well. The idea is that if in 2027 a baby is born, by 2047 that baby will be 20 years old. We are talking about 100 years of India by 2047. If that 20-year-old is nurtured and cared for in a completely different way, along the lines of what I was talking about earlier, surrounded by intelligence, even before the baby is delivered, the pregnancy is managed through an embrace of coaches and telemedicine, guidance is given to the mother if she is anemic, early detection of high-risk pregnancies if she is, has a low birth weight pregnancy. All of this is not possible. So how do you put that together in a program and then continue it to a 3-month-old baby, a 6-month-old baby, early detection of, say, neurodevelopmental defects? Today, if you're an autistic child, you may be picked up at the age of 5. But AI can allow you to pick it up at the age of 2. And if you pick up an autistic child at the age of 2, it may not be autistic.
Oh, wow.
Because you can do interventions at 2, which you can't do at 5, right?
Yeah.
So I'm just using that as a small example. Autism is a common problem, but this applies to everything. Even today, if you look at the statistics, a huge number of Indian pregnant women and babies are malnourished. Why is that? Are we short of food? No. It's just because they don't know how to improve their hemoglobin from 9 to 12.
Yeah.
They don't know that diluting the milk in a baby is causing malnutrition in the baby. It's okay to have a slightly softer stool in the baby, but let the baby get the protein. So there's a lot of gaps in the way we are bringing up our current generation. So there is
But
this
there's lack
whole
of knowledge.
lack of knowledge, but knowledge not leading to action. See, knowledge is there on the Ministry of Health website. In the ASHA manual, it is there. Is it reaching the woman? ASHA manual, there are 10 lakh ASHA workers in the country. They talk to the women in the village. How can that ASHA worker be augmented by AI capabilities or robotic capabilities or drone capabilities? So there is this new idea that first of all, India has a responsibility to shepherd the next generation of humanity. All over the world, Japan, Italy, South Korea, fertilities have fallen to such a level that populations are shrinking, right? India is not there yet. Therefore, it behooves us to build the strongest humans possible. And I'm not only meaning in the physical sense, even in the mental sense.
Absolutely.
Are these babies good at critical thinking? Are they good at play? Are they good at teamwork? Do they see the world as their playground? Are they caught up in narrow domestic walls like Rabindranath Tagore said in his famous poem? So how do we prevent all of that, and how do we enable the best possible child to emerge by 2047 to lead this country to, this country and maybe even the whole world to a better future?
Yeah.
So, I think we all, whether we work with the government or we work outside the government, should think about these questions. That's one thing I would credit Mr. Modi with, that he has given us this vision of, what is India going to look like in 2047?
Right.
Nobody was talking about that. We used to talk about next 5 years, next elections, next government, last 10 years, caught up in what I would call petty political battles, caste battles, sports battles, whatever. Now we should be asking ourselves, how do we want the world to be in 2047? It is an arbitrary number, but it's an important number in a way. It's 100 years.
It's a good
of
target.
Our country.
It's a good
target to be thinking about.
Yes.
So I think so this is one program that we are building, but I would even expand that thought further for the audience and everybody in this room, that the world has seen technologies developed for Western problems, rightfully so, because they were developed in the West, right? Now, with the democratization of technology, a large language model is available here.
Yeah.
Drones are being built up in India. Robots are being built up in India. So, I think there is a massive opportunity to build tools to solve problems for India and then take them to the world. And UPI and the whole citizen stack that has been built has proven that A, this is possible, and B, it really works like magic.
Right.
And the UPI journey, that MasterCard and Visa spoke heavily against it, that this is a bad idea. It still happened. Aadhaar was supposed to be a bad idea. It still happened. And guess what? All those bad ideas combined together to build this magical system that allows us to do 13 billion transactions in 1 month free of cost. Nowhere in the world is this possible. And now India is leading this. So why not in healthcare is the point, and why not in education? These are the two areas we really struggle, and these are the real pillars of society. Are you a healthy individual? Are you a well-educated individual? Not by the standards of NCERT and CBSE, but by the standards of critical thinking, teamwork, problem solving, ability to learn and improve the world and to contribute to the world. So I think these are two areas of health and education that we must, really put our efforts into. And you are already doing it. So congratulations. You are in the right place at the right time.
No, thank you so much. You being generous, definitely. It's a long journey for us as well. But as I said, whenever I speak to you or listen to you, I get inspired. And so many things you spoke about. What excites you personally the most? And your new startup, NeuranceAI, what is it that is right now, as you mentioned, is the purpose that is driving you forward?
See, it has always been large scale impact, meaningful impact, at least in healthcare. I can't argue that I can contribute to nuclear physics or to quantum mechanics. I don't know enough about that. There's only that much you can learn about. But healthcare is something I have focused my last 3 decades of my career in different avatars. And it would be very, very satisfying to be able to build something here in India, in Bangalore, and have that used by billions of people around the world, with leading to meaningful impact in their lives. Right. So, I mean, there's a joke. Delhi is very hot, right? And whenever I go into an air-conditioned room, I still bless the inventors of air conditioners because, whoever invented it, I think it was one Mr. Carrier, the Carrier aircon guys in way back in 1913, 14 time frame. But the point is, these solutions that we are building, you are building, we are building, should become so commonplace around the world that people should give blessings to us. That, look, you have done something which is magical and we take it for granted. That is something to live for, and that is what we are living for.
Awesome. No, that's I think very similar thoughts. And health is a area where that impact is very high. You literally will let people live a better life.
Yeah.
So, which is Dr. Bakshi, one advice to the listeners, to the young healthcare professionals, maybe the doctors who are either interning or getting into their practice, and this journey that you have seen, and what is it that they should always keep with them? So one advice from you.
See, I hear a lot of, what should I say, dissatisfaction and frustration in young doctors around the world. I mean, I was in UK the other day. A lot of young doctors are on strike. US people are struggling. They're not wanting to do healthcare or professional medical, jobs. I would actually argue that the ability to help other human beings, like you said, live a better life, is a very big gift.
Yes.
It is a very big gift. It's enormously satisfying even to have one father come and say, Doctor Sahab, aapne meri beti ki jaan bachai, right? And that's what doctors do.
Yeah.
They do, save lives, help overcome pain, help overcome disability. I think there are very few other human professions which give you that gift of helping another, right? So I would encourage not only young doctors, but even non-doctors to want to learn this skill and art of, it could be a nurse, it could be a health tech company. Now in the modern world, it's not going to be led by doctors, it's going to be led by a whole range of professionals. But being able to help other human beings live a better life is enormously satisfying.
Yeah.
Right. So I first want to say that as a foundation. And I want to invite people to enjoy that gift, to first earn that gift and then enjoy that gift. It's very, very satisfying. And the second part is, use that knowledge to build upon your capabilities. You are now living in a time where you can do 10x of what you could do earlier, thanks to all the other surrounding ecosystem that has developed in internet and connectivity, in AI, in robotics, right? So use that to live more fulfilled lives, to contribute more, to do more, is the message I would like to give. So, and don't allow negative vibes to distract you, because the real satisfaction that you get from that one interaction with a patient, or a happy doctor as a customer, or a happy hospital CEO as a customer, is way more than all the frustrations that you get to face on the journey.
Yeah. And I mean, there is, you mentioned about this satisfaction of touching a life, and that's what I personally have also observed when I was doing travel. Travel is also satisfying because you give happy moments
Absolutely.
to people. You
Absolutely
go around with your family and you have fun, or your friends, and so on and so forth. But when I look at health and what we are doing right now, obviously now we're working with doctors, working with patients. The feeling is that we are allowing people to live better life, or we are helping in that journey. And we are not just talking about those happy moments when you travel. So it practically is very satisfying, as you rightly mentioned, for us, for me, myself as well, as a health tech founder.
So you used to do journey through geography. Now you're doing journey through time.
Yeah.
That's all you're doing.
Great. I think, Dr. Bakshi, this was, I think, very amazing interaction. As I mentioned that I enjoy and get inspired always. And somehow I feel that there are a lot of thoughts that you have that resonates to me directly, like personally as well. I hope we can do this again also whenever, and would love to host you in our office whenever you are in this side of the town.
Thank you so
very
much.
much.
Thank you.
Thanks.
Great.